Imagine walking into a clinic where your vitals are already analyzed, history is already analyzed, and lab trends are already analyzed, and the doctor starts with a plan that fits you perfectly. Now, imagine that same system misreads your data, or gets hacked, or quietly bakes in bias that nobody catches. That's the promise and the risk of AI in healthcare. I'll keep it real and simple. First, the upside. AI is a powerhouse at pattern recognition. It spots tiny signals in images, labs, and notes that humans miss after a long shift. Think earlier, cancer detection on scans, faster stroke triage, and predicting complications before they blow up. It also kills the paperwork monster, summarizing visits, drafting notes, sorting prior auths, so clinicians get more time with people, not portals. And it can personalize. Medication choices tuned to your history, reminders that fit your life, and language that meets you where you are. Another win? Access. Smart chat and voice tools can translate medical jargon, support rural clinics, and extend specialist-level guidance to places that never had it. For public health, AI watches trends, flags outbreaks, and helps hospitals staff up before the waiting room explodes. When it's done right, care gets faster, more accurate, and more human. Because the humans finally have time again. Now the catch. Data is messy, biased, and often incomplete. If a model learns from skewed history, it can repeat it, overtesting some groups, undertreating others. Privacy is real, health data is gold, and breaches can be brutal. Some models hallucinate, confidently wrong, and that's dangerous if a note gets pasted into real care. Over-reliance can de-skill clinicians, and black box decisions make it hard to explain why a call was made. Plus, who's liable when AI gets it wrong? The doc? The hospital? The vendor? Regulations are catching up, but care moves faster than policy. So how do we use AI without losing the plot? Human in the loop, always. AI should propose, not dispose. Show the receipts. Models need confidence scores, reasons, and links to evidence so clinicians can check the work. Audit constantly, bias testing across demographics, version control, and clinical outcomes, not just accuracy on a benchmark. Privacy by design, minimize data, encrypt everything, and never use patient info for model training without real consent. Clear off-ramps. When AI isn't sure, it should say so and step back. And teach both sides. Clinicians need AI literacy, and AI teams need healthcare literacy. For patients, ask simple questions. Was AI used here? What did it recommend? How confident is it? What happens if we ignore it? Good care teams will welcome those questions. Bottom line, AI won't replace clinicians. Clinicians who know AI will replace those who don't. The goal isn't robot medicine. It's smarter, safer, more human medicine, with AI doing the heavy lifting and people doing the caring. If we keep ethics, security, and empathy at the center, we get the best of both worlds. If we don't, we're just automating old problems at scale. Your move. Demand transparency, reward time with patients, and treat AI like a colleague who needs supervision. That's how we get healthcare that actually feels like care.